this might be tough to watch, but for thousands of athletes and weekend warriors, this is reality. A shoulder dislocation can sideline you fast. But what happens after the injury? Do you need surgery? How do you get back to doing what you love? I'm Dr. Lauren Linus, Doctor of Physical Therapy. If you want to avoid further dislocations, learn what your rehab should look like, and dive into whether you need surgery or not, stick around. If you've just dislocated your shoulder, don't panic. In many cases, it can be reduced, put back into place, with a trip to the ER using a method called a closed reduction. This non-surgical procedure involves specific movements performed by a trained person to put the shoulder back in place. However, it's important to know that after a first dislocation, the chance of re-injury is high, well over 20%, especially in individuals under the age of 40. That's because the dislocation doesn't just affect the joint itself, it also damages surrounding muscles, ligaments, and tendons. That's why rehab is crucial. Strengthening the muscles around the shoulder can greatly reduce the risk of it happening again, and rehab should begin within a few days or weeks following the dislocation, depending on the severity and when you were cleared by your care team. More on that in a bit. First, let's discuss the types of shoulder dislocations and what is actually happening. When we look at the shoulder joint and its anatomy, it's no wonder we see this as a common area for dislocations. The shoulder joint is made up of the glenoid fossa and the humeral head. The glenoid fossa is shallow, which allows for the amazing mobility that our shoulder joint offers. However, this decreased depth naturally leads to more instability of the joint itself and more reliance on soft tissue such as the labrum and the joint capsule to provide stability. Now, when it comes to dislocations, the most common type we see is a traumatic shoulder dislocation, meaning we fell on an outstretched arm, got tackled funny in a contact sport, etc. The second category is an atraumatic shoulder dislocation and instability. This is defined as abnormal motion or position of the shoulder that leads to pain, subluxations, dislocation, and functional impairments, and is not a result of a traumatic injury. An example here would be a baseball pitcher or a swimmer who has developed increased mobility in certain ranges, more from overuse than from trauma itself. Now that we understand the anatomy of a dislocation, let's jump into how to rehab it and lower the risk of it happening again. All right. Let's get started with range of motion exercises. It's important to begin to work into ranges that may feel intimidating because of the stress that it puts on the anterior shoulder, especially if you have dealt with an anterior shoulder dislocation. Now, the important key here is to listen to your body and work through ranges that always feel comfortable and tolerable. Progressing when ready is very important, and you should always make sure that you're respecting the tissue's healing time as you perform range of motion exercises. A question we often get asked as PTs during early rehab is, will I need surgery? The answer here is, it depends. Generally, when it comes to shoulder dislocations, there is a lot to consider, such as age, type of sport the individual wants to return to, the tissue that was damaged, and it should be a team design on what is the best option moving forward. A study performed in 2023 found that those who have had an atraumatic shoulder instability and dislocation had very similar outcomes to surgery with appropriate rehab and conservative treatment. Now, regardless of if you choose to undergo surgery or not, the goal of conservative rehab is to reduce pain, improve any limitations in range of motion, and improve strength and confidence of the use of your shoulder. So let's get into strength next. We want to be sure that we are spending time working on the muscle recruitment of the muscles that support the glenohumeral joints. Closed kinetic chain exercises can be a great way to start to provide stability to the joint. Now, progression to more weight-bearing based exercises is key to continue to strengthen the muscles of the shoulder joint. Start with exercises that are bilateral in nature, with progression to unilateral exercises such as a plank with shoulder taps or a side plank. Lastly, when ready, we can add in reactive exercises and plyometric. These play an important role if looking to return to sport or partake in a higher level of exercise. Remember, these should only be progressed to when ready, and it's important to take the necessary steps to get to this point in your rehab journey. All right, let's talk through the big takeaways when it comes to shoulder dislocations. Number one, shoulder dislocations can look very different, and everyone's journey of what they want to get back to doing also looks very different. Be sure that you chat with your care team about what makes the most sense for you and your rehab goals. Number two, regardless of if you choose to get surgery or not, rehab will play an integral role in getting you back to your previous level of activity. Don't skip on your rehab. Number three, appropriate rehab progression with a shoulder dislocation is key. We want to respect the tissue while also working to build up stabilization and confidence in the shoulder joints and its supporting musculature. Now, if you're looking for further programming for your shoulder dislocation or shoulder pain, be sure to check out our shoulder rehab program and shoulder prehab program on the app. Until next time.